Public health messaging for meal timing, risks of oversimplification. The translation of emerging nutritional science into public-facing recommendations presents perpetual challenges, with time-restricted eating offering a particularly instructive case study in how oversimplification can distort evidence and potentially harm public health. Media coverage, social media influencers, and even some healthcare communications have reduced complex, nuanced research findings into reductive sound bites that promise benefits unsupported by evidence while obscuring limitations and risks. This communication failure serves neither scientific integrity nor public health goals, demanding more responsible translation frameworks. The typical oversimplification pattern follows a predictable trajectory. Preliminary research, often animal studies or small human trials with methodological limitations, demonstrates some positive outcome in specific contexts. Media coverage strips away caveats, magnifies effect sizes, and universalizes findings beyond their evidence base. Study shows intermittent fasting reverses aging, transforms nuanced findings about cellular autophagy markers in mice into sweeping anti-aging claims. Social media amplifies these distortions, with influencers presenting time-restricted eating as a metabolic panacea, requiring neither caloric attention nor personalized implementation. The resulting public perception diverges dramatically from scientific consensus. The calorie confusion exemplifies this problem. Most public messaging fails to clarify that time-restricted eating's weight loss effects primarily reflect reduced caloric intake rather than timing magic. People implementing time restriction while maintaining or increasing calories experience disappointment when expected results fail to materialize. This false expectation reflects communication failure. Researchers understand the caloric mechanism, but public messaging obscures it, perhaps because eating windows help you eat less sounds less revolutionary than timing rewrites your metabolism. The former accurately represents evidence. The latter drives clicks and product sales. Vulnerable populations receive insufficient attention in public messaging. The standard promotional content presents time-restricted eating as universally beneficial, rarely acknowledging contraindications for adolescents, pregnant women, individuals with eating disorder histories, those with certain medical conditions, or people taking specific medications. The absence of clear exclusion criteria in popular communications puts vulnerable individuals at risk, as they lack information needed for informed decisions about whether time restriction suits their circumstances. Professional communications should lead with "who shouldn't try this" rather than burying contraindications in fine print. The mechanistic mythology deserves particular critique. Public communications frequently invoke autophagy, cellular repair, and metabolic switching as established human benefits of time restriction. Despite these mechanisms being primarily documented in animal models or short-term human studies with unclear clinical significance, autophagy occurs during fasting, but whether the magnitude achieved through 16-hour fasts produces meaningful human longevity or disease prevention remains speculative. Presenting speculative mechanisms as established facts misleads consumers and creates expectations divorced from evidence. Evidence-based public health messaging requires transparent communication of uncertainty alongside established findings. Messages should explicitly state when evidence comes from animal models, acknowledges when human data remains preliminary, quantifies effect sizes realistically, and frames benefits in terms of caloric management rather than circadian mysticism. For example, some people find restricting eating to specific hours helps them consume fewer calories and lose weight. Research suggests this works primarily through eating less rather than changing metabolism directly. This approach doesn't work for everyone and may not be appropriate for people with certain health conditions. The tone matters as much as content. Authoritative proclamations about optimal eating windows presume more knowledge than science possesses. Appropriately humble messaging acknowledges uncertainty, presents time restriction as one option among several evidence-based approaches and emphasizes individualization. We're still learning proves more honest than science shows when evidence remains preliminary or conflicted. This honesty might reduce viral potential, but better serves public health by setting realistic expectations and maintaining trust in health communications. Professional organizations and research institutions bear responsibility for proactive communication rather than allowing information voids to fill with misinformation. When preliminary studies receive media attention, timely expert commentary providing context could moderate overinterpretation. Creating accessible evidence summaries for healthcare providers enables informed patient counseling that counteracts misleading online content. Social media platforms could partner with scientific organizations to elevate accurate information and flag misleading health claims, though implementing such systems presents substantial challenges. The goal isn't suppressing information about time-restricted eating, but rather ensuring public communications match evidence quality. Promising preliminary findings deserve discussion alongside explicit uncertainty acknowledgments. Potential benefits can coexist with clear contraindications and limitations. The public health communication challenge extends beyond time-restricted eating to all emerging nutritional interventions, but this case study illustrates how current approaches frequently fail to serve either scientific integrity or public welfare. Improving these communications requires commitment from researchers, institutions, media, and platforms to prioritize accuracy and appropriate nuance over engagement and oversimplified narratives. Public health ultimately benefits from truth-telling, even when truth proves more complex and less sensational than simplified myths.